World Breastfeeding Week is an annual global campaign coordinated by the World Alliance of Breastfeeding Action. This year, WBW 2024 aims to inform, anchor, engage and galvanize action on breastfeeding and related issues. The theme for this year's World Breastfeeding Week, which is from 1st to 7th August 2024, is Closing the Gap, Breastfeeding Support for All. This theme celebrates breastfeeding mothers while highlighting the ways families, societies, communities and health workers can provide essential support to them. Hello and welcome to Healthy Living on Trust Television. I am Aisha, Salihu. And now joining us today to talk about the importance of breastfeeding and creating support for working mothers and mothers in general is Dr. Ogechi Akalonu, Head of Nutrition at the National Primary Healthcare Development Agency. Thank you so much for joining us.
Thank you. Happy World Breastfeeding Week, Nigerians.
Now, before I come to you, Dr. Ogechi, evidence has shown that exclusive breastfeeding for the first 6 months of life decreases the risk of malnutrition and death in infants. Prompting adequate feeding for infants and young children through optimal breastfeeding is crucial. As of the most recent data available, approximately 34% of mothers in Nigeria practice exclusive breastfeeding. While this represents an improvement from the previous years, there is still room for growth. Initiatives to promote breastfeeding and provide support are critical to ensuring the health and well-being of both mothers and infants. Based on recent reports, approximately 34% of Nigerian mothers practice exclusive breastfeeding. Efforts to increase this percentage are essential for child health and development. Now, Dr. Ogechi, I'd like to come back to you again. My first question to you, I'd like to know, can you tell us in detail the importance of breast milk to the life of an infant and also the components of this breast milk?
Thank you, Aisha. Happy World Breastfeeding Week, Nigerians. Breastfeeding is very key to the life of the child and the mother and even the communities and Nigeria. Breast milk is a safe food, complete nutrient to the child. As soon as the baby is born, within the first 1 hour of birth, there is need to initiate breastfeeding, early initiation of breastfeeding. And then exclusive breastfeeding from 0, the day the child was born, to 6 months. No water, no herbs, nothing. 0 water, only breast milk to the child. And also continuing breastfeeding up to 2 years or beyond, because breast milk has all the nutrients the child needs. It has carbohydrates, it has protein, fats, vitamins, minerals and water. Breast milk has immunity. It can improve the immune system of the child, giving the child a healthy start, a safe and healthy start, improving the eyes of the child, the skin, the hair, the body system, improving growth, development and survival. Breastfeeding can also prevent infections, diarrhea, respiratory tract infections. Breastfeeding can also improve bonding, improve love between the mother and the child, and also prevent some forms of cancer. You know, breast cancer, ovarian cancer, the mother will not have these issues. Breastfeeding can also prevent some forms of diabetes when the child grows up, obesity, and all some forms of cancer. You know, from the child. Okay. Breastfeeding too also help the community because it's earth friendly. Breastfeeding does not upset the earth. You know, it's environmental friendly. You don't cook it, you don't buy it in the market. It's only the mother and the child. So breast milk is the best food, is the best investment we can have to improve the nutritional status of children and also their mother.
All right, Dr. Ogechi, quite a number of significance you have highlighted there, a numerous amount of significance. Now, this now brings me to this line of question. I'd like to know, are there any medical conditions that can prevent a mother from breastfeeding? And if yes, kindly educate us on what alternatives can be made to ensure the child gets adequate nutrients.
Every mother can breastfeed, given information, given adequate knowledge, skills to breastfeed. Every mother can do that. Every mother in all their diversities, whether you're rich, whether you're poor, whether in the comfort of your house or in IDP camps, emergency situation, crisis situation, every mother can breastfeed because breastfeeding is safe, breastfeeding is key. However, there are some medical conditions that may prevent women from breastfeeding. If a woman is diagnosed to have cancer and the breast is removed, maybe 1 or 2 breasts are removed, or the mother died as a result of childbirth or other conditions, breastfeeding may not be achieved if there is no donor that can provide breast milk, or if there's no grandmother or wet nurse that can provide breast milk. So the nurses, the health workers need to counsel the mother for her to make informed decision, making sure that she has all the information that will make her have a optimal formula feed information, and we call it AVAS, provided the options are acceptable, is visible, is affordable, is sustainable, and is safe. So the mother can have that option. And there are also medical conditions that will always allow the mother to breastfeed. If a mother is having HIV, of course, she can breastfeed, giving all the information. With ARVs to the mother, to the child, the mother can exclusively breastfeed the child and continue breastfeeding up to 2 years or beyond. So most medical conditions can be managed and a child can have optimal breastfeeding.
Okay, I know we're talking about support for mothers to achieve optimal breastfeeding for the child, and this now brings me to the point where I'd like to ask, what foods would you suggest a mother includes in her diet to support breastfeeding? Because that has always been the issue for some mothers.
Before a woman gets pregnant, she needs to have adequate nutrient stores. That is why adolescent nutrition is key. The girl child nutrition is key before she even gets married. Pre-pregnancy nutrition is very important before a woman gets pregnant. And when you're pregnant, there is need for you to visit the health facility, 8 contacts, ANC, to go there and receive counseling on how to eat right and healthily. Ensure you participate in food demonstration sessions. Ensure you have your iron, folic acid, or multiple micronutrient supplements. Ensure you have SP, preventing malaria in pregnancy. All the interventions that we give pregnant women at the primary healthcare centers, you need to receive those so that you have a good pregnancy outcome. So that when you give birth to your baby, you have enough nutrients in your breast milk to be able to provide adequate, optimal nutrition to your baby. Reducing food insecurity, things are hard now. Food is very, very expensive, and the medical bills. So you need to eat healthily, you need to eat right to have adequate nutrient stores so that when you deliver your baby is good to start. You provide exclusive breastfeeding for your baby to start safe and strong.
Okay, but then I'd like to know, are there any dietary restrictions that mothers should be aware of while breastfeeding?
The mother should know the wholesome, viable foods. Nigeria is blessed with nutritious food. And the mother should eat every local food available around her. She should avoid alcohol. She should avoid smoking. She should avoid dangerous herbs. You know, all those anti-nutrient foods. She should avoid them and eat right and healthily to make sure that she has a good nutrient status to be able to provide nourishing breast milk to the child. So the mother should eat right. The mother should avoid every harmful practices, every food that is not healthy, like pastries. Most pastries are not healthy because they have trans fatty acids. Right. They are not, most of them are not healthy, so she should avoid it and eat locally available food. She should make sure that her diet has at least 5 food groups combined to be able to have the 6 classes of nutrients: carbohydrates, protein, fat, vitamins, minerals, and water. That food, that wholesome diet will provide for her to eat right and healthily.
Thank you so much, Dr. Ogechi. Now, protecting, promoting, and supporting breastfeeding will save more lives of babies and children than any other single preventive intervention. Protection and supporting should come from society, family, and workplace. So, first off, would you say the Nigerian environment supports breastfeeding?
Nigeria is a breastfeeding country, and breastfeeding is a national assignment because a well-breastfed child is an asset to Nigeria. It will improve productivity at work, it will reduce illnesses, it will reduce somebody being lazy, absent from work. You know, it will enhance productivity and the investment, you know, in Nigeria. So Nigeria is a breastfeeding country. On the 1st of August this year, Nigeria gathered women. Over 31,000 women breastfed their children at the same time in different locations. So, but we need to do more. We need to do more. The warm chain of support of breastfeeding, everybody, the media, like I'm here working with the media, the government, the community, the civil society, ministries, government and agencies, everybody need to be involved, need to support mothers. Mothers should breastfeed anytime, anywhere. They shouldn't be ashamed of breastfeeding in public. They shouldn't be ashamed of breastfeeding in their offices. So we need to help the mothers not to start choosing between the work and the home. Choosing between the work, is it to go to work or to breastfeed my child? There is need for us all to get involved. Now, involve and support mothers to breastfeed optimally.
In respect of support, how can we then ensure that breastfeeding is normalized and not censored in public life?
Is to make sure that we implement the 6 months maternity leave, giving the woman that opportunity to breastfeed, exclusively breastfeed her child up to 6 months and then get ready to go back to work. Is for the community, the population to be aware of the benefits of breastfeeding. To create the awareness, everybody, sensitize everybody in Nigeria to make sure that women breastfeed, to make sure that we protect, we promote, and we support breastfeeding anywhere we found ourselves. Whether in the IDP camps, whether in emergency situation, whether in crisis situation, and the quality of breast milk is the same. No woman should feel inferior breastfeeding, because if you are from a royal family or from my village in Owerri, the breast milk has the same quality, has the same nutrients. So women should be proud, should build confidence and breastfeed their children, because it's a very good thing to do.
On that beautiful note, now we'll go very quickly to the streets to hear from Nigerians about their knowledge about how it is necessary and important for us to create support for breastfeeding mothers, regardless whether they're in the workplace or even at home, and also the responsibility and roles of fathers. We'll be right back.
The role of father can play in breastfeeding the baby during the time of breastfeeding is to make good provision for the mother, so that we'll be having the breast will have enough water.
Can go and look the money, buy food, and give the wife, so that if the wife eat, the baby and the children, they can happy, so that he can grow very well.
The role as a father or as the head of the house, you need to follow up with your wife to ensure she breastfeeds the children, because breastfeeding is the best option for the children's life. And so we just have to ensure you monitor it and ensure your wives to do that.
Thank you so much for joining us. Well, there you have it, the opinions of Nigerians on the streets about breastfeeding and the crucial role it plays in a child's developmental stage. Now, supporting breastfeeding mothers in the workplace is crucial for their well-being and the health of their infants. Dr. Ogechi is still with us. I'd like to hear from you, Dr. Ogechi. What policies do you suggest can companies and organizations implement to allow flexible breaks for breastfeeding or pumping?
Women are very, very productive and hardworking and focused. So employees should employ women in their offices, because we are very hardworking human beings. And there should be policies that improve breastfeeding at workplace. Workplace should have a crèche, it should have a breastfeeding room, and their colleagues should also support breastfeeding mothers at work. Support them in sharing tasks, support them in making sure they breastfeed their babies at work. By so doing, Nigeria will be better for it.
Now, the support and role of partners and society play a crucial part in promoting successful breastfeeding. I'd like to hear from you, doctor. How well do you think partners support mothers during breastfeeding?
Partners have been doing a lot. We've been doing a lot. National Primary Healthcare Development Agency is a parastatal of Federal Ministry of Work, Federal Ministry of Health and Social Welfare. We've been working together with partners, Nutrition International, UNICEF, WHO, Wellbeing Foundation, My Life and Thrive, Vitamin Angels, and USAID, Helen Keller. A lot of partners support the cause of protecting, promoting, and supporting breastfeeding. But there's need to do more. There's need for us to have a stronger collaborative partnership, empowering health workers by training, empowering communities by engaging them more, making sure that we provide practical support to mothers anywhere they are in their diversities, making sure that we work together to improve exclusive breastfeeding rate from 34% to over 50% come 2025 next year, and up to 70% by 2030.
Okay, now let us bring it to the family structure now. A father's or partner's support is one of the most important factors for a mother's breastfeeding success. This impact starts even before the baby is born, and a partner can influence whether a mother chooses to breastfeed. While a father or partner may not physically be able to breastfeed their baby, what ways can you then suggest that they support their partners and also wives or mothers?
We need male involvement in breastfeeding. We need men to assist us at home, house chores, provide food, nutritious food, encourage us, discuss breastfeeding at home with their wives. We also need men to accompany us to ANC section, listen to the health workers, counseling, participate in food demonstration. We also need men to help us in positioning and attaching the baby to breast milk. We need that encouragement. We need men too to help us co-feed the child with breast milk. When the mother is asleep, when the mother is resting, we need that encouragement, you know.
Now, still talking
men.
about spousal support, a father's support, or a husband's support, I'd like to know, how do you suggest that partners actively encourage and support breastfeeding mothers during the early postpartum period?
Yes, men can support us by encouraging us, telling us kind words, reading out the 10 steps in successful breastfeeding, reading and observing all the flyers we give women during ANC about breastfeeding, helping us to feed the child with breast milk when the mother is resting or sleeping, helping us to massage the back of the women to improve breastfeeding, helping us with house chores, you know, and loving us.
Yeah, you talked about partners helping to read out, you know, the 10 steps of breastfeeding. I'd like to know, what are the 10 steps that as a guide for breastfeeding?
Making sure that at health facilities, you have these 10 steps, you have the policies pasted at the wall of the health facility, making sure that children are exclusively breastfed.
What are the 10 steps to breastfeeding?
That is what I am saying, ensuring that at health facilities that the policies and guidelines are pasted on the wall of the health facilities, making sure that early initiation is established within 1 hour of birth, exclusive breastfeeding, only breast milk, no water, up to 6 months, and continuing breastfeeding up to 2 years or beyond, making sure that hygiene is practiced, hand washing, hand sanitation, environmental sanitation, making sure that the environment is clean and safe, making sure that we have support group, because when the woman is discharged from the hospital, she goes home, and then we need the support group, the women group, to support her, visit her, encourage her, make sure that she developed the skills. You know, what she was taught during ANC is being practiced. Positioning and attachment, you know, making sure that the woman eats right and healthily, and she's happy, you know, breastfeeding her child at home.
Now, we're talking about community support now. Now, let us now talk about families' involvement. How can extended family members contribute to a positive breastfeeding experience?
Yeah, everybody is responsible. Everybody needs to work together. Everybody needs to come together to train, support a child. So when a woman is pregnant, people need to be around her, support her at home, encourage her to visit the health facility for her ANC health contacts, you know. And then when she delivers, people should also be around her, making sure she's having rest, she's eating well, she's breastfeeding her child day and night, up to 8 to 12 times in 24 hours, making sure that she's loved, she's giving all the support, and then making sure she can. There are so many breastfeeding positions. If she cannot sit, she can lie down. She can. There are different positions. So people need to help her to achieve optimal breastfeeding. Okay, Dr. Ogechi, just before we let you go, very quickly, let's look at misconceptions of breastfeeding. And now we have myth. Breastfeeding is easy. Some people will tell you breastfeeding is easy. How true is that? Yes, if you do the right thing, it's very, very easy. But if you do the wrong thing, it's painful, it's difficult. Okay, some other people would also say sore nipples are inevitable. How true is that? If you do the right thing, if you position and attach your child properly, you will not have cracked nipple, you will not have sore nipple. Breastfeeding is very, very good. It's very, very, you enjoy breastfeeding when you do the right thing. Okay, so is there need to separate newborns from mothers for rest? No, you don't have to. The baby need to stay with the mother at birth. During in the labor room, there's what we call kangaroo mother care, skin to skin. The mother should be with her baby. You know, 24 hours. Okay, another myth should be with her baby. Another myth, you know, before we let you go. For love. Yeah. Look, another myth before we let you go. Some say exercise affects milk taste. How true is that? It's not true. Like I told us before, the quality of breast milk is the same, whether you're from a royal family or from my village, where it's the same. It provides all the nutrients, all the 6 classes of nutrients, and also antibodies, that fight infections, and also growth factors.
Okay.
Breast milk is rich. It's a complete food for the child. And whether your breast is small, whether your breast is big, whether it's full, whether it's standing, whether it has stag, there's no reason not to breastfeed.
Okay, thank you so much.
So we tell our men to be part of this.
All right.
Don't tell your wife, no, I don't want you to breastfeed it because I don't want your breast to sag. Even a virgin's breast can sag,
okay,
whether she breastfeed, whether she's not breastfeeding. So why don't you breastfeed your child and
okay,
allow your child to start strong,
thank you
start
so much,
safe, and be a healthy Nigeria in adulthood.
That's the much we can take from you. Thank you so much, Dr. Ogechi Akalonu, who is the head of nutrition, National Primary Healthcare Development Agency in Abuja. And in conclusion, as we celebrate World Breastfeeding Week, let us commit to closing gaps, reducing inequalities, and fostering a culture where breastfeeding is not only accepted but celebrated, I beg your pardon. By standing together, we can ensure that every mother feels empowered, every baby thrives, and our collective future is brighter, one nourishing drop of milk at a time. Before we go, we'll leave you with some facts of breastfeeding. And that concludes this week's episode of the program, Healthy Living on Trust Television. For comments, contributions, and suggestions, do well to follow and subscribe to all Trust TV social media handles. Download the Trust TV app on iOS and Android devices across their respective stores and get live updates on the YouTube live stream and the website. Join us next time as we continue to explore subjects crucial to your health and well-being. I am Aisha Salihu. Thank you so much for your time.